Hi friends, do you get the urge to pass motion immediately after having food? Most people find it relieved after passing motion. And most people have the feeling that the food goes directly from the mouth to the anal canal and it is evacuated out. But this is not the answer to this. Now, the phenomena of passing motions after meal is called a gastrocolic reflux. It is an involuntary reaction of food entering the stomach and causing the colon to contract by means of hormones. Some of the people have mild symptoms, some may have a severe and intense type of gastrocolic reflux. Now, there are many trigger factors which can cause this gastrocolic reflux to be very intense. Now, you should remember that our digestion takes around 48 to 72 hours. So, it is not exactly the food which you eat is immediately expelled out, but basically, it is the food residue or a fecal matter in the colon which is expelled out. So let's find out what are the trigger factors and what are the causes. I'll be sharing the mind note now. So when I look at the symptoms, so let's start with the mind note, pooping after meals. The first thing is it's called a gastrocolic reflux. And what are the conditions associated with the gastrocolic reflux? The first one is the IBS, irritable bowel disease, which causes the exaggeration of the passing motions after meals. The second one is food allergy or food sensitivities. If you are intolerant to any type of food, will trigger this reflux. Third one is anxiety, gastritis, celiac disease, and inflammatory bowel disease like Crohn's and ulcerative colitis. Sometimes change in microbiome is also causes this pooping after meals. What do you mean by the microbiome? Microbiome are the bacteria in our gut, and gut is called a second brain. If there is a change in this bacteria, if there are harmful bacteria in the gut, then this will trigger this pooping off after meals. So how do we manage this situation? The management is based on three factors. The first one is changing the diet. Now you as such can manage it at home. You need not go to visit a doctor because it is a normal involuntary phenomenon, and it can be easily managing by means of changing your diet. You have to identify your food triggers. Now, how will you identify the food triggers? Basically, you have to do a food diary. So what is food diary means? You do a charting of whatever foods you have on a daily basis. In my program, I give them a food diary and I tell them to chart this on a daily basis. So if you want to find solution for your digestive process or digestive issues, then join my free webinar which happens every week. The link will be there in the comment section. So it's a free webinar, you can join that and you can learn how to heal your gut. Now coming to this topic, changing your diet. So we have to identify which are the foods which trigger this gastrocolic reflux. It could be greasy food, it could be spicy food, it could be foods which is high in fiber, it could be dairy products, caffeinated drinks. So you have to identify which foods are triggering this and you have to omit those foods. So that is one thing, changing your diet. Second one is could be managing your stress. Now stress is a very important factor which triggers the gastrocolic reflux. If you can manage your stress by means of doing meditation or pranayama or focusing on your breath, then this stress management techniques will help you in managing your gastrocolic reflux. And third one is lifestyle changes. What we require is good amount of hydration, 2 to 3 liters of water, good amount of sleep, 7 to 8 hours of sleep. Avoid caffeinated drinks. If you're having excessive amount of alcohol, you have to avoid it. Smoking can be a trigger factor. So these are the lifestyle changes you need to modify, which will help you in managing this gastrocolic reflux. Now, usually it is a mild phenomenon. You need not visit your doctor. But there are certain situations where you have to visit your doctor. So which are the situations? The first one is if you have intense and frequent gastrocolic response to food, you have to repeatedly go to the toilet after having any food stuff, then probably you have to visit your doctor. Second one is if you have diarrhea lasting for 2 or 3 days, then probably the chances of dehydration, you have to visit your doctor. The third one is if you have gastric symptoms like gastritis, severe abdominal pain, then probably you need to visit your doctor. Otherwise, this is a mild phenomena. It can be managed and the fully managed. But if you have any of the three things like intense and frequent gastrocolic reflux is diarrhea, which is lasting for 2 or 3 days, and additional gastric symptoms, you have to visit your doctor. If you like this video, please share this video to your friends and see you for the next video. Take care. God bless.